Well, nearly 200 cases of the measles have been reported across the U.S. so far this year. And for the first time in 3 years, Tennessee is among those states. The measles cases have been reported in Madison, Shelby, Gibson, Hamilton, and Hardeman counties. But people in other areas may also have been exposed because some of the patients were traveling while they were contagious. 6 News anchor Lori Tucker is here now with more in this week's Caring for Our Kids. Lori.
Hi, Kristen. You know, while everyone should be taking precautions against becoming infected with measles, it is especially dangerous in children. We want to talk about that today. With me here is Dr. Katie Stordahl from Children's Hospital. Always good to see you.
Thank you.
So let's start things off with what measles is and how we can get it.
Measles is a virus, and it's one of those viruses that many people think doesn't exist anymore because we vaccinate against it, and so people don't hear about it very often. And when we have cases such as those that have been reported in surrounding counties, they're almost always amongst unvaccinated children. It can start out like a cold, high fever and cough, then a runny nose develops and red eyes, and then a few days into the infection, the characteristic rash develops. We have some pictures I think we're going to show. And the rash starts on the top of your head and then gradually spreads down to your feet. The fever can be very high, the rash can be miserable, but there are actually more important things about this virus that we vaccinate against than just that rash and the fever.
Let's talk about that.
Right. So 1 in 1,000 children who gets measles is going to die from pneumonia caused by the measles. 1 in 1,000 children who gets measles is going to die from encephalitis or brain infection caused by the measles. Those are the most severe outcomes, and that's actually why we vaccinate against this illness.
So for this to manifest, it has to be an unvaccinated child who's in that contagious period playing with another child who also happens to be unvaccinated, and then it just snowballs from there, right?
Or traveling with an adult on a plane or a train or a bus, and that adult is not vaccinated and the child is exposed. A person is contagious 4 days starting before they have the rash and the symptoms, so they may not know that they have measles when they are exposing others to it.
All right, so we've talked about the risks of spreading it to East Tennessee for that very reason. Are there any others you'd like to share with us about, you know, what parents need to be mindful of?
Well, I really believe every parent has the right to choose to vaccinate or to not vaccinate their child. And I think some people have really very legitimate concerns about vaccines with the health of their children. If they have those concerns, they need to talk to their doctor, because the preservatives that people worry about in vaccines have been taken out. There is no link between autism and the measles, mumps, and rubella or MMR vaccine, and vaccines help to prevent illnesses that still exist. That's the most important thing, is because people think those illnesses are gone, and they're not.
Yeah, a lot of us thought that. All right, Dr. Stordahl, always good information. Thank you so much. The key here, every parent needs to stay informed.
Yes.
All right, and make sure you email me with your questions, ltucker@wate.com. Kristen.